Hi, my name is Brianne Snyder, and the career that I'm wanting to do is occupational therapy. To become an occupational therapist, you will first need to obtain a bachelor's degree. This can be in any subject, but you will need prerequisite classes. These classes include physics, psychology, anatomy and physiology, statistics, abnormal psychology, and there might be a few more depending on the school. You'll also need 80 to 100 hours of shadowing a registered occupational therapist. This usually takes place in multiple settings, so maybe a hospital, a nursing center, pediatric center. And you will also need to take the GRE exam. You will then need to obtain a master's degree in occupational therapy. This is usually 2 to 3 years. In that time, you will complete 24 weeks of supervised field work. Some people do a doctorate degree, and this is usually an extra year to year and a half. After you have graduated from a master's program or a doctorate program, you'll take the National Board for Certification in Occupational Therapy exam and to become a registered occupational therapist. And then you can apply for your state license. Occupational therapists must continue education after graduating. After they take the National Board for Certification in Occupational Therapy, this certification lasts for 3 years. In this 3-year period, they must obtain 36 units. So this could be volunteer time, quizzes that show that you still have the knowledge. This could be workshops, online classes. There are many different things, and they all have different units. Some are like 6 units, some may be 18 units. So every 3 years they must update the National Board for Certification. They also must renew their license each year. Each state is different. Florida's requirements are 2 hours of prevention medical errors and an hour of HIV/AIDS. The main organization for occupational therapy is the American Occupational Therapy Association. They have many resources on their website, from job searches to school searches to how to become an occupational therapist, along with current news. And they also have national conferences each year that allow other OTs to meet. The other organization is the National Board for Certification in Occupational Therapy. This is the organization that you take your boards exam through. Their website has very many resources such as practice tests, flashcards. You can apply for the exam through it, and it tells you how to renew your license. The daily duties of an occupational therapist are to meet with patients and review their history and ask them questions. They will evaluate the patient to come up with a treatment plan. If they find that therapy is needed, they will set goals for the patient to meet. They will set up different activities for the patient to perform to help them towards their goals. Some of the goals might be for a child to put like 10 pegs in a board. For an adult, it would be to lift their arm and brush their hair on their own. And so they'll make different activities to help them be able to do these things. In terms of scope and practice, occupational therapists teach self-care activities such as being able to brush hair after an arm injury or getting in and out of the shower after a hip injury. They also recommend assistive equipment such as wheelchairs. They help with early intervention, so children who are not developing the basic skills that they should be, they help develop these. They help with sensory issues. Children and adults might have difficulties with different textures or tastes, so OTs will develop activities to help them cope with these. A child might also have difficulties with gross motor skills, such as balance and coordination. This makes it hard for them to participate in recess or be able to climb stairs. So OTs will develop things like obstacle courses to help them strengthen these skills. They will help with fine motor skills such as handwriting, being able to stack blocks, put pegs in a board. They demonstrate exercises to strengthen the joints, and they help patients to participate in daily activities So for children, this would be to play with other kids, and for adults, this would be to take showers on their own or make themselves a meal. Occupational therapists work with many different healthcare professionals. They'll work with the physician to come up with a treatment plan, and they'll work with physical therapy and speech therapy, sometimes in joint therapy, because they'll have similar goals that they want the patient to reach. They may work with the patient's psychologist or their behavioral therapist if it helps reach the patient's goals. There are a variety of work settings that an occupational therapist can work in. The most common is a hospital, but there are still many that work in nursing homes or outpatient facilities. Many work with pediatrics, either at a standalone facility or in a school. Some work in mental health and some do home health, but there's also a variety of other settings that they can work in. This is my 5-year plan. I am a senior and I'm graduating this month, a week after I start graduate school for occupational therapy at the University of St. Augustine here in Florida. The first 4 semesters are all at the school. And then in August of 2020, I'll start my first field work. This could be anywhere in the US, Florida, or even out of the US. I'll do another field work in January of 2021. I will then return to St. Augustine in May of 2021 and start a doctorate program, which I will continue in August, and then I will graduate with a doctorate degree in December of 2021. In January 2022, I'll take the National Board for Certification in Occupational Therapy exam, and I'll apply for state license. I then hope to work at a hospital for the first 2 years to gain a lot of experience, and then I would like to work with pediatrics.